Good evening, everybody. It's a pleasure for me to be here today with you, and thank you very much for having me to talk about the nursing informatics competencies and different ways to achieve them. So the objectives for today's presentation, we're going to start by defining nursing informatics. All right, so we're going to define nursing informatics, and then we're going to discuss the benefits. Why do we need nursing informatics in our institutes and hospitals? What kind of forces that facilitate the emerging of this new discipline and the progress of this new discipline as well, and what kind of competencies different health organizations recommend for bedside nurses at different levels to have in nursing informatics. Well, nursing informatics is one of the disciplines that emerged in the past maybe 25 to 30 years. And as you know, nurses is the largest health professionals among the other health professions. And that's why it was very important with all the IT, health IT technologies we have and applications to have a discipline called nursing informatics, just to shape the way we use technology and just to improve the quality and safety of patient care. There were different organizations defined the nursing informatics. So I found the ANA is the kind of the detailed one, but you're gonna find many definitions. This is kind of really comprehensive. So the way they define nursing informatics in the scope and standards of practice that was issued in 2008 is that it's a discipline that integrates nursing science, computer science, information science, and cognitive science in order to manage and communicate data, information, knowledge, and to reach to the wisdom in nursing practice. And you will find the data, there's a difference between the data, the information, and the knowledge and the wisdom. These are the building blocks or the main concepts in any nursing informatics framework. And you're gonna find almost all textbooks in nursing informatics talk about this framework. So this is another definition by the American Medical Informatics Association. I used many abbreviations, but they're all spelled out in different slides. The American Nursing Informatics Association, there is a nursing informatics work group. They work with, they are the representative, the US representative in the International Medical Informatics Association, and this is the definition they provided for nursing informatics. Now, why do we need nursing informatics? I guess why we don't need nursing informatics. So this is the correct question to ask, because now if we want to describe the healthcare system in these days, we're going to say it's a high-tech, high-technical, high-technological, digital, mobile, remote, virtual, whenever you use the telehealth applications to provide virtual or remote care for your patients. So plus, our patients are not like before, I believe. We're moving toward the participatory model of participatory medical model, where the patient is not only a passive recipient of the care, he's also a consumer, and he can judge you, and he can discuss with you different options. He checked in the online, etc. As well, our patients, they use different kinds of IT applications, like the portal, patient portal. How many of you have patient portal in your institute? Anybody? No one? Okay, so a patient portal is an IT application that the patient uses. He accesses it in order to access, or he uses it to access his electronic health record. He can view his lab results, diagnostic, procedures. He can view the results of all these, and then he can text message. He can get in contact with the clinicians who was assigned to this patient by texting, and a lot more. Plus, we have the different personal health records. So the patients, in many cases, especially in chronic conditions, we have different applications where the patient can actually access his record and maintain his vital signs and maintain his lab results. So he actually entered these, and this is in the US, I'm not talking about somewhere else. So he can access his electronic health record, and he can be a very active participant in the way he set up the plan of electronic health record, and he can follow up in his condition. So nursing informatics came out because if we're gonna ask for high quality, high safety, standardized care, definitely we need nursing informatics. We need this specialty in order to guide us in the best way to use the different applications in health system. Plus, all the standards now, all the movements, all the activities are moving toward the creating an EHR or electronic health record that have high level of utility or usability, interoperability, which is a very important term in informatics, where you have systems that talk to each other. I know one of the systems in New York City that has, one of the hospitals, I'm sorry, that has 60 different applications, IT applications, to provide healthcare. Now, all of them, they do talk to each others. So the billing, the insurance, the administrative, the patient records, the barcoding, whatever, they do talk to each other. So interoperability is a way we can not only improve the health information exchange within one organization, but also the dream is, and it's not anymore a dream actually, we have this applied in many institutes now, is that to have these systems talk to each others and share patient file or records between more than one organization, not only for sharing purpose, but also for comparison of the outcomes. So this is the kind of the participatory medicine where the patient is active part in the health care. Now, the benefits of nursing informaticist or informatician. This is the nurse who has extra degree or experience in nursing informatics. We call her nurse informaticist or nursing informatician. Any of you have a department for nursing informatics? Okay, very good. So these people, they work as the translator between the nurse clinicians and the IT personnel in order to provide, or in order to improve the workflow of the nurses, to provide the care that we request, to include the standards and procedures within the care. We have too many forces that are driving toward nursing informatics, too many. These are only a few that I listed in 2 slides. The first one of them, AHIMA, is the one that I send you. It's the American Health Informatics Management Association. They listed some competencies for health professionals. Actually, they focus more on the allied health professional more than in nursing piece. But if you view the activities and the competencies, you will find that all of these, the nurse should know how to do it. So they said that a workforce capable of innovating, implementing, and using health, what is that? Communication. There's something wrong. This is communication, should be. I'm sorry, this spelling mistake. And information technology will be critical to healthcare success. I'm sure all of you or are familiar with the Robert Wood Johnson Foundation, who funded the QSIN. QSIN, which is a quality and safety education for nurses, they have, I think, yearly workshop, kind of, and it's free for the first 10, 30, whatever participants from different institutes like academic and practice. They do this yearly workshop funded by the Robert Wood Johnson Foundation just to improve the inclusion of the nursing competencies and other competencies into the curriculum. So they're focused mainly on the education, improvement of the education, rather than on the clinical piece of the nursing field. And they develop these competencies. Like in the informatics competencies, they have different informatics competencies. They categorize them under domains, if you will, like some of them under the knowledge, some of them under the skills, some of them under the attitudes. The landmark IOM report, everybody's familiar with this. It's about the future of nursing. In this report, actually, nurses were recognized very well as change agents and leaders in the transformation of health IT, of health information technology, and they were kind of really empowered in order to have a very critical and active role in the design, implementation, and evaluation of different IT applications. The TIGER, the one I sent you in the email, which is the Technology Informatics Guiding Education Reform Movement. It started in 2006, and it included more than 40 organizations. Many of the informatics experts and other experts in the education, informatics, and in the clinician piece or side of the nursing field. And they try to build a vision for the best practice utilizing IT. So they have too many documents. If any one of you would like to start thinking about the competencies, I think you need to start with the TIGER. the AACN Essentials for the BSN Education document, they have 9 essentials, and one of them focus very specifically on nursing informatics. The NLN, they have a position statement where they stated the agenda for nursing informatics. As again, they in the NLN position statement, they focused mainly on they provided recommendation for faculty and deans more than the practice side. Now we have the ANA, we mentioned the ANA. Again, the ANA textbook about the scope and standards of informatics actually focus more on the informatician, or informaticists. So they said that if you have this discipline, what kind of role these experts they should have. Now the work of the Office of the National Coordinator of Health Information Technology on electronic health records and IT applications mainly is governed by the Health IT for Economic and Clinical Health, which is the HITECH Act, which is part of the American Recovery and Reimbursement Act. They issued too many standards, too many criteria for meaningful use and certified EHR. Anybody doesn't know what does this mean? You all know? Okay. Information technology, in the NCLEX exam, we have 20% we have few questions out of the safe and effective care environment category is related very clearly to the information technology. HIMSS, which is Health Information Management Society, Systems Society, it's a very well-known and recognized information or informatics, medical and nursing. The focus mainly on medical, but the nurses, they do have a very good role in this. Nursing informatics organization, and they have, again, a position paper about transforming nursing practice through informatics, where they do recommend different competencies. Now, the IOM clearly stated that the United States has the opportunity to transform its health system, and as I said, they recognize nurses as the main profession to do this. And I think all of you also familiar with the interprofessional teamwork competencies. One of them is informatics. So these are all forces. In the HIMSS position statement that was published in 2011, the nurses were recognized as leader to develop the infrastructure of nursing informatics, and they do recommend actually to support the development of informatics department and to support the leaders in informatics. This is just to give you this is what was written in the NCLEX website. So this is kind of the activities under the information technology objective that the students have to achieve. So this is part of the academic part of the informatics. As I said, the National League of Nursing in 2008, they have recommendation for faculty, deans, and the National League of Nursing themselves, how to expand the positions and how to work on it and how to fund informatics projects. So this is part of the faculty recommendations. And these are the essentials of the BSN education from the AACN. And as you see, number 4 clearly talk about the information management. But if you check, like we have probably 2 or 3 others very related to informatics competencies. Do you know any of these related to informatics competencies? It's actually the third one, scholarship for evidence-based practice, because evidence-based practice means simply information literacy. And information literacy is one of the skills in information management and one of the skills in informatics as well as information management. And even if you check the number 6, interprofessional communication. Now, if we have an effective interprofessional communication, we should know how to use the IT applications because all our documentation is electronic somehow in different institutes. Now, these are the QSIN. The QSIN, they develop pre-licensure, which is competencies to be used in the undergraduate nursing curriculum, which means that all of your newly employed registered nurses or newly graduated registered nurses should have these competencies because these should be actually main part in the curriculum in the education. And they do have informatics competencies for a graduate. So they have the 2 of them. As I said, the ANA is used mainly if you want to see what kind of competencies your nurse informaticist or informatician have, more than what kind of competencies your any bedside nurse may have. And this is the matrix they develop for these kind of experts. Now, this is the, I guess, a very important part of the presentation. We mentioned was one of the main forces in health informatics. Actually, the Tiger, they developed a model for health informatics. They said every nurse, bedside nurse, should have these 3 competencies. Well, they look very simple. There are only 3. But if you go under each one of them, there were like, I don't know how many, maybe 15, 30, 40, whatever, under each one of them competencies. So they are very detailed, but the main umbrella is that computer information, information literacy, and information management. The Tiger said that every nurse, practicing nurse, should have the European Computer Driving License, which is the ECDL or the ICDL, International Computer Driving License, whatever. So they're very comparable. So I don't know how many of you have heard about this term or this certificate. Now, if every nurse practicing nursing now should take this is going to cost tens of money for the institute if the institute is going to pay. So, and this is very long, and it has too many modules. So what the Tiger did, they just picked some of these modules, and we're going to discuss these modules in a minute. So they said these are the minimum set of computer knowledge that any nurse should have. Now, the information literacy, if you check the American Library Association website, or if you check the New York University Library, they offer an excellent self-paced tutorials for evidence-based and information literacy. So anybody wants to improve the skills of information literacy, you can refer your stuff to these websites. In terms of the information management, basically the competencies were taken from the HL7, which is the health level 7, and we're going to talk about this in a minute. These are some of the modules. So the driving license, it just gives you the competency on how to drive on a computer. So you have to know different applications. Like, for example, you have to know the word processing. You have to know the PowerPoint, the spreadsheets, these applications. And plus, so these are applications. And it's not like you have to know. So you, for example, in a word processing, you have to open a file, save a file, copy paste, whatever we're doing in our daily life. So you have to know all these competencies or activities or skills, let me call them, and similar to the spreadsheet and using the database. So if this is one of the competencies, I'm going to focus on the using the database. If this is one of the competencies, I don't know how many of the nurses, of your nurses, bedside nurses, use databases. I believe none, right? So nurses are, most of the time, they're not really involved in databases. They're just involved in one patient at a time. And even most of the time, they don't look to they don't utilize the functions in the EHR that shows them, like the dashboard or the patterns. They don't utilize these functions to show them what is the pattern of care for this patient, unfortunately. So the main reason is in the training and in the lack of education. As well, many of the in-charge nurses and the nurse coordinators and the case managers, they don't know how to use the databases for insurance information, for incidents information, for pattern, as I said, for capacity, for budgeting. They just got this information from the risk department or from the quality assurance department. And this shouldn't be the case. All nurse in any leader position, they should know how to access the database and provide a summary of the outcome of the care they are providing. So, so part of them is these applications, and then the other part is browsing a web, communication like an email, like Web 2. We have the Web 2 now, social network applications like the Facebook. So, and especially if your hospital decided to have a Facebook account or something, or to use the Facebook in any of its application. So the nurses, they should be very competent in using this application. So this is part of it, and it goes in into too many details. So it's networking, for example. There is safety and security. It's all other things you can imagine in the computers. I forgot how many modules exactly, but it's very long, and the book is like this thickness. And I forgot how much it cost. But anyhow, it's not an easy thing to do. Now, the information literacy competencies, these are simply, information literacy means if, for example, you want to Google something, or do you want to search a database. I don't know how many of the nurses are really competent in using databases. I've done research in Jordan, and they were very small amount. Some of them, they never heard about the databases because they don't use them at work, and they graduated years ago, before the 80s when we started using the databases. So definitely they will have no clue about the databases, electronic databases, and I mean like CINEL, like PubMed, and Science Direct, whatever you have. So information literacy means the nurse, she can retrieve the information, she can use the appropriate and the correct search terms in order to retrieve whatever she wants to retrieve. She knows how to formulate the appropriate questions. She knows how to make a history of whatever she's pulling out from the web. She knows how to evaluate the results of this information and organize them. Now, information management simply is, it's how you manage your case using, or your patient, how you manage the patient care using the electronic health record. Can you pull a summary sheet from electronic health record and view it and then decide based on this from, because the summary sheet, it pulls information from different systems actually and from different applications. So when you pull this summary sheet of your patient, can you interpret it in the appropriate way? Can you know what is missing in order to provide the appropriate care? This is the AHIMA. As I said, if you see the competencies, and I always ask myself the same question. Now we have the IOM, we have the QSIN, we have AHIMA, EMEA, ENIA, all of these, NLN, whatever, different organizations. If you check all of them, they always talk about the same concepts: evidence-based, patient-centered, quality, safety, informatics. These are the core competencies. And everybody says something, maybe one sentence in informatics or any of these in a different way. So I wonder why they just we have one paper, one position statement, one recommendation, whatever, from all of these organizations. But I believe that this one was more focused to the allied health. The IOM, some of them focused to physicians, some to nurses, some all health professions. So QSIN for education, whatever. So it seems like everyone is taking a piece of the field and just publish about it or recommend something for the progress. So if you see that health information literacy, we have the literacy, we have the skills to use EHR, we have the technical security. This is a main piece in the management and in the literacy, and we have the basic computer skills. These are all mentioned in the Tiger. And even the confidentiality and privacy, it's mentioned somehow in the Tiger. So they didn't actually add too many things to the Tiger. They were just incongruent. And as I said, you have the full matrix, as it says, it's published somewhere on the website. This matrix, as I said, it was developed for the allied, for the ancillary care or allied health professionals. But if you go through these competencies, can you see any of them? I'm sorry if you can't see at the back, but can you see any of them not applicable to the nurses? Like if you pick, let me just read for the people at the back. Describe the principles of structure, design, and use of health information. Use health records data collection tools, such as document templates and input screens. Apply standard data definitions and vocabulary. Differentiate between the types of content of patient records. Adhere to the health record documentation requirements like the JCO. So they all apply to the nurses. So these can be used as one of your references if you want to implement competencies. Now we talk about the meaningful use. You have a list of objectives you have to maintain and to say that we accomplished the core objectives of meaningful use, stage 1 or stage 2 or whatever. We have 3 stages. I'm going to go quickly over them. I mentioned this, so I want to have some time for the group activity. All right. So simply the meaningful use is using a certified EHR. And there are many criteria for what we call certified EHR. And these criteria include, no, I'm not going to talk about the criteria, I'm sorry. So the meaningful use, we use certified EHR in order to improve quality and safety. It's the same thing. Engage patient, improve whatever security of our data, maintain privacy, you know. So hopefully the compliance of all this will result in better outcome. Now the certified EHR, one of the criteria for a certified EHR, it has a CPOE, computerized provider order entry system. Another criteria is that clinicians can run drug or can check the drug allergies. Okay, they can run drug interaction. They can pull a summary sheet for the patient for the patient. So there are too many objectives. It's not too many actually. I forgot how many in the maybe 15 in the stage 1, kind of 15 for the HR. So in order to be reimbursed for excellence in quality by the Medicare and Medicaid, whatever, if you have a certified EHR. So this is the reason behind the certified EHR. These are the stages, and I'm just going to give you a quick overview. Now, why I'm talking about this? Because if you have a certified EHR, if I say that one of the core objectives in a certified EHR is that all nurses, they should know how to pull a summary sheet for their patient or list of the problem list. If I'm telling you this, and this is one of the core objectives, it means that all these functions the nurse should be competent in, right? So she should have, or he should have the competency in all of these functions, because this is a certified EHR. It runs in a special way that will improve the utility and the patient safety. That's why the objectives of the certified EHR are really important. So in stage 1, if you see, it's focused mainly on capturing health information, communication, and then move to the information exchange to the improving of population health. So it adds actually some kind of different criteria in each stage in your EHR toward population health at the end. Here I don't know why I have question marks in here, but here you can find the everything about meaningful use and certified EHRs. However, now in many cases, things, they don't move the way we expect they should move. Or so there was a report to the president in 2010 listing the barriers to using the EHRs and different health IT systems. Number 1, they are not easily adopted. Why? What is that?
People hate change.
Some people, they hate change, not me. And sometimes they don't match the way nurses just do their work. So they make the work much more complicated, much more documentation, you know. And I've checked one of the system recently, and I've seen this, I wouldn't name it because maybe you'll know the system. Whatever, it's one of the sheets, one of the fields that should be completed, and it has maybe 100 fields in it in one page. And this is way too much. And if you want to complete it. And some of them, they were kind of required. And some of them, they were just, I don't know why they're listed. But even if I'm a nurse, I don't want to look at a sheet that have too many questions. I just want to document whatever I'm doing in a very efficient way. Exchangeable, they are not exchangeable, which means that the applications, they don't talk to each other. They are purely internal resources. And that's why it's really hard for many of the institutes now to move to the exchangeable part of the goal, because they don't like to share their electronic records with other institutes. Part of it can be logistics, policies, whatever. And I believe part of it can be whatever we were talking about, like putting your course online. It just find your mistakes. Can be. So, and the cost, of course, and all these other issues. Introduce patient privacy and security concerns. There are too many patient privacy and security concerns in using IT applications, too many. So that's why the nurse should be very competent in this skill on how to maintain the privacy and security. This is a very good reference for you if you, again, oh, by the way, I didn't mention, I'm working now in the university hospital system. We just started in a project to see what kind of competencies the nurses they need and what is the best way to achieve these competencies. If any of you like to join us, I believe I can talk on behalf of them, you are more than welcome. So we can make this kind of project for more than one institute. So Staggers is a very well-known, Nancy Staggers is a very well-known expert in informatics. In 2002, she published this, Informatics Competencies for Nurses at 4 Levels of Practice. And by the way, many of the Tiger documents, they were just based on this document. So I think you care about, since the focus of this presentation is the nurse, so we're going to focus about these two and not the informaticists. So we're going to focus about this. So if you see that the beginner or the beginning nurse, fundamentals, I'm sorry, I use IM here in information management because of the space. So whenever you find IM. So fundamental information management and computer technology. This one, proficiency in one domain of interest, like education or administration or practice, whatever. And then she should be very skillful in the information management skills. And she can judge, she can manipulate data, she can forecast, she can predict what is coming next from the data. But the beginner nurse, she doesn't have to. And these are the computer skills. And this is comparison between the beginning and the experienced nurse. If you see the one in oranges, they're shared. And so the experienced nurse, she should have all of those plus the oranges, focus on the oranges, plus the quality improvement. So the one, the beginner nurse, she doesn't have to have quality improvement nursing informatics skills for quality improvement. And this is, again, this is another application or example. So the beginning nurse, she should know how to use the administrative applications, IT applications, for practice management and structured data entry. Like, she should know how to fill the blanks. She should know how to complete the demographic information of the patient. She should know how to, the structured data, like if you have an acuity system, she should know how to use this. But for the experienced one, she should predict, budget, monitor, manage. So these are very high level of nursing informatics competencies. I'm not talking about nursing competencies. And these are more examples. Now, these are the resources I told you about. This is for the nurse informaticist. If you want to see, for example, to have like a job description or whatever, kind of include in your scope of practice some of the skills that the nurse informatician should have. These are different resources. This is a very interesting one because this is it lists all jobs, all kind of titles in nursing informatics, and it gives you a job description for every one of them, and the jobs available as well. So this is very interesting. The first one, we have 2 articles. So this is the 2012, and this is the 2009. So these are all JAMIA. JAMIA is the Journal of American Medical Informatics Association, and the American Medical Informatics Association, this is the EMEA. These are very excellent and highly prestigious articles and journals in informatics. The other one is as a conference, but they do have a journal as well. Now, we're going to go to the final part of the presentation. We're going to, all of us, develop a plan, either by discussion, whatever you want to do it, by 2 groups, 3 groups, 1 group, whatever you prefer. But before this, I'm going to just keep on for 10 minutes discussion. And this one, in the coming 2 slides, these are approaches to implement and achieve the competencies. In the Tiger website, they have cases. So if I'm work at the UHS, so I'm going to report my case and say, okay, we achieved the competencies by 1, 2, 3 strategies. So these were different hospitals. They just shared with us their experience on, and this is public access, so you don't have to be like, you don't have to subscribe or anything. Anybody can access all the documents of the Tiger except the virtual learning You have to pay $25 for this. So anyhow, so they use one of the hospitals, for example. What I didn't see really very useful in these cases is that most of them, they just list, well, okay, I use train the trainer, I use computer labs, I use one-to-one training, I use super user, which are a nurse in any unit that she used the system in a very excellent way. She knows everything about the system, but she's not a nurse informatician. She's a super user, and she mainly monitors the other nurses. So they use structured and unstructured instructions and whatever they use. So you're gonna see only list of whatever they use, but if you're really interested, you can email them and say, okay, what kind of competencies did you use, and did you pick from the 60 whatever competencies in the Tiger, and how did you implement these competencies specifically? And these are all other, like some of them, they use the American Library Association, like the website we just discussed for the information literacy, and they have, some of them, they give CDs for the nurses with the basic computer literacy. The basic computer literacy is the easiest, I believe, because you can just post, you can have in your intranet, whatever you communicate with your nurses, you can have just a file, or for the continuing education website, you can have a file for all these competencies, how to use Word document, how to use the email appropriately, because this is very critical. Many people, they don't know how to use the net etiquette and how to use the email, and how to browse, and the information literacy as well. All of these can be demoed easily in a self-paced kind of tutorials, but I believe the focus should be on the information management, which how am I going to use this system to improve patient care. This is another hospital. They published actually their work in 2013. They picked some of the Tiger competencies, and they, after validation from expert content, we call them, which are nursing informaticists, they picked some of these. They picked 51 for basic computer skills. They picked 9 for the clinical information management, and these are more, if you want to read, these are more examples of clinical information management. So they capture the data, they demonstrate the procedure confidentiality, etc. And these are the information literacy, the 10 competencies for information literacy. So it was like a nurse informaticist to work in that hospital with a group of nurse informaticians. They developed, or they picked these competencies, and then they validated this through content validation, which is part of the research, just to make sure that you are measuring what you are measuring and you didn't miss anything really important. And the next step is going to be, they actually surveyed their nurses, but in this paper they just wrote about the instrument development and the content. So as well, if you are really interested, you can just contact them, and I believe everybody is happy to share. Now, before we're going to meet, I need you, and I'm going to come back to this slide. I'm just going to keep it when we start the discussion. These are the very important things to be think about. These are very important points. What levels of nurses you have? What kind of training do you offer? And do you offer the training before the implementation of the EHR or during the implementation of the EHR? And what kind of contents do you focus on the training? I've been in different trainings just to understand the system from a user perspective. And I've seen that most of the training, they focus on the technical piece of the system more than the value piece of the system. So just show me how the system is going to improve my work while you're showing me the technical piece. So, oh, look at this. This is the dashboard. Oh, how nice it looks. But I don't care how nice it looks. I care that if I use this, I'm going to show a pattern. I'm going to see the pattern of where I have to intervene. So all these, the value of the system should be, I believe, a very important part in the training. So, and how often do you repeat your training? When I ask nurses, usually they have only one-time training face-to-face in a computer lab that is run for 30 trainees, 20 to 30, and they have no other resource. And if you don't know, if you forgot any function in the EHR, definitely you can't be trained on one system, one session, or even 2 sessions, or even 3 sessions. You need much more training than this. And you need another support learning resource for your nurses. So you need a video kind of, or a super user video demonstrating how she's using the system. So think about this. As well, what kind of applications do you train your nurses in? Are all devices should be trained on the same as the IT? So all computerized devices should be trained, the nurses should be trained on, as well as the system. Okay, now the method and all these, I believe they are also very important aspects of the training. So do you do it one-to-one? Do you have train the trainee? Do you have super user? Do you have a large group, 1 session period, I'm done? What kind of method do you follow for the training? Because this is very important for the nurses to gain the competencies of the system. What current IT adoption behaviors do you have? I'm going to talk about the adoption quick after this. What technology applications you have, how up-to-date you are, what kind of resources you have, training resources, and what is your IT strategic plan? If my IT strategic plan is to include the patient portal and the patient experience system, which is a system that has, I don't know how many, maybe hundreds of videos, teaching videos for your patients, and it allows them to even go back and view their teaching summary and everything, and Skype and message. So do you support this or not? Okay, what kind of competencies you're gonna pick, which model, and what are your goals? This is a study done in Korea, and I don't think the US is really far from this or any place else, because they found that the majority of the nurses, they have low computer competencies and low informatics competencies. These are the behaviors of the people usually when they adapt a system, and I'm sure all of you know about this. So some of them, they're risk takers, they love it, they personalize it in a wonderful way. They are very creative in the way they use the system. They develop this personal list for their patient, and they ask more, but unfortunately, these who use the workaround to manage their patient care, they don't share it, unfortunately. So they keep it only for themselves. Some of them, they just hate it. Some of them, they like it because they're leaders, they just adopt it. And you have the resistance. It's always really important to track the history of any implementation, because if you find one trend in one unit, it means something. It doesn't have to be the technology. It means maybe some people within this unit, the majority are resistant to the system. I love this article, and this is very nice. I wish like everybody pull this article. This is 2001. It's old, but I love it. This talks about the e-health. What does e-health mean? E-health means electronic health, if you define it. So any electronic application health. But this person, he defined e-health, and he said it's not only the E electronic, it's 10 E's more. So it's evidence-based, it's efficiency. These are the promises, actually. And this is social media, one article about the social media. This is really funny. I just would like to share it with you in a few seconds, is that one of the physicians, suppose he's a cancer patient. I forgot what kind of patient he is, but suppose he has a cancer, and he has his oncologist, okay? And he found that his oncologist, he's a physician as well, that he has an address or account in the Facebook. So they got connected, and then they were friends, and they were discussing, health issues, and he was consulting with his oncologist. And then at the end, his oncologist unfriended him from the Facebook because there was a policy, this is in London, in Britain, issued in that hospital, says that this is gonna affect the patient confidentiality, which is true. So always be aware of what kind of, this is nice as well, because if you scan the websites or even the literature, the references, you will find 13,000 applications we have so far, health application, 13,000 for cardiac, for mental, for diabetes, for whatever. These are the percentages of them. Now, if your patient is using the smartphone apps, and the nurse, she never used an app, how you're gonna teach him which app to select? How you're gonna teach him how to use the app? Some of them are very useful applications and free, and some of them they're not. So there are criteria as well for useful applications. I love this slide, and I borrowed this from one of my colleagues. He presented a webinar about transforming digital data into useful information. This shows you if I want to capture data related to the catheter associated urinary tract infection. If you want to capture this, if you want to measure the percentage of this, so you're going to need all this data in order to say we have this percentage, which means if I share this with my nurses, like you need to fill this field because this is going to help you, or this is going to help me know this. So this is the operational definition of this concept. So if you share this kind of applications with your nurses, they're going to realize the value of the system. It's not like I just need to document. You document because this is really important to show the outcome of care. So we're going to have SMART goals now: specific, measurable, achievable. During this 20 minutes left, and in summary, I just want to say that building the competencies must be definitely collaboration. You say that there is part in schools, we have practice, we have policymakers, we have organizations, and assessment and training, they never end. Always show the value of your system, include informatics in the scope of practice, and always think about lifelong learning skills. And in this last point, I just would like to share with you a small story. A short, small story is that when this was when I think in my undergraduate program, they were teaching us about the pressure ulcer, which I really hated. Because the presenter, the lecturer at that time, who was teaching me the pressure ulcer, I don't know, for some reason, I just don't like the pressure ulcers. So one day, I just was watching a movie. And in that movie, it was science, imagination, whatever movie. And I don't remember the name or anything or the actors. What I remember is that I saw patients sample, which they used them as for their experiments. They were flying on the air, floating, so no beds, but they're lying, like as if you have a bed, and they have all their electronic equipment next to them. And then I said to myself, oh gee, if we have this kind of technology, I didn't say technology that time. I wasn't thinking even I'm really interested in nursing informatics. If we have this kind of treatment method, we would never teach a pressure ulcer. So this is not going to be one of the topics really important to nurses. So, and I believe we are moving there. Now we have voice recognition systems, we have all this kind of technology. So I hope I presented to you a useful information, and we're going to start work now. Thank you very much.